Yeah, how are you? Yeah, U.S. President Donald Trump, Elaine, just talking right now as we speak in the Rose Garden of the White House. You know, after pointing the finger at governors this week, then, of course, pointing the finger at the World Health Organization and suspending payments, he is now moving on to his next controversial decision, which is about reopening the U.S. economy. He's been on the phone to business leaders and other leaders behind closed doors in the last few hours. Now, all of them are saying, look, we want to get back to work, but we need more testing across the nation and our places of businesses, as well as social distancing methods. But the U.S. president, very gung-ho, wants to start doing that and says there's going to be some sort of plan announced in the next 24 hours. Let's take a listen.
The data suggests that nationwide we have passed the peak on new cases. Hopefully that will continue, and we will continue to make great progress. These encouraging developments have put us in a very strong position to finalize guidelines for states on reopening the country, which we'll be announcing. We're going to be talking about that tomorrow.
Well, these are going to be guidelines. Remember, he said that he alone had the authority to decide when to reopen the economy. Then he changed his mind yesterday in the Rose Garden on Tuesday, saying that he's authorizing the governors to come up with their own plans. The problem is here, there are more plans than there are solutions at the moment. It's going to be very interesting to see whether the U.S. president picks out the date May 1st, because remember, he wants to open the economy as quickly as possible. He first of all wanted it in Easter, which was last weekend. Now it's May 1st is the date we hear from the White House is when he has. But of course, governors have other ideas about slowly opening up the economy so we don't see a spike in cases. And the testing thing is really, really important, because it's not just testing for COVID-19, but antibody testing, as well as contact tracing, which countries all around the world have done. But as of now, the U.S. not doing as well. And new antibody testing, which the president just hailed in the Rose Garden, is known to have significant problems as well.
And Nathan, 24 hours ago, you and I were talking about the big bombshell out of the briefing. We're seeing strong reaction now to President Trump's decision to end funding to the World Health Organization.
Yeah, not just globally, but domestically too. I mean, we had Jimmy Carter come out, the former president, with a statement. The second biggest funder, by the way, of the World Health Organization is not a country, it's the Bill and Melinda Gates Foundation. And Bill Gates, the founder of Microsoft, also coming out and condemning that. And not just critics of the president, but also his own director of the CDC says, look, we've worked very well with the WHO in the past on Ebola and other viruses around the world, and we continue to do so. But the U.S. president does have the authority to hold up funding, about $400 million worth this year. Quite incredible that during a pandemic, where the WHO's expertise is needed around the world, especially in developing countries, that the one-time leader on global health, you remember Barack Obama with Ebola and teaming up with Chinese scientists, you remember George W. Bush, and the PEPFAR initiative with HIV, AIDS in Africa. These were real global leadership roles. And now we are seeing the opposite. You know, America first in a pandemic could mean America last, especially if the virus comes back.
All right, Nathan King.